So we will look at childbirth. When a woman is in labor, there's a lot of fear involved because, of course, there is the pain, but there is also the actual birth, which many things can occur that can cause difficulties. But then there is also the actual coming out of the birth canal and making sure that the baby is well, etc. So there is a lot of energy around the actual birth that is not just about getting the baby out. Because then you have people that are around who are distressed because the woman is maybe screaming in the pain. So there is a lot of energy. So what we would say about the actual birth is that there is a conscious effort to create a space that is conducive to calm, that is conducive to the actual giving of the birth. So a place that is inherently quiet, where there are limited people around, because people's energy, whether they are supportive or not, whatever, when the woman is going through this incredibly wonderful experience, but also very traumatic experience, it brings up in other people other fears, other reminiscences, etc. So it is well for the woman to have herself, whoever is birthing, the midwife or the doctor, what have you, and if her husband or partner or what have you is going to be there, or her birth partner, this is enough. Because what the focus is on is about getting the baby out. You see, that is the focus. But it is also the woman needs to be focused on as well, because when a woman is in labor and there is the pain and there is the fear of problems with the birth, and then the baby will be all right when it comes out, because you just don't know. So there is a lot of this going on. For the woman then, with all of these things going on, other issues in the life will be brought up. You see, it's not that they would be vocalized necessarily or even thought of, but it is like a sloughing off. You see, there's so much physical agony going on, but then that is very emotional. And then there is also the mental aspect of, will the baby be all right? Is the birth going to be all right? All of these things. So this brings up other issues for the woman that have gone on through her life that may not be, as we say, vocalized. For example, she may have a very stressful job. And so all of the stress that the body and the spirit and the emotions have gone through while she's in this job are going to come up because the body is in such a state of flux. You see, it is an extreme state. So all of this is going to be activated as well. But she may not realize it and it may not be vocalized, but it is. So that is adding. You see? So the focus needs to be on keeping the woman supported. Calm is a possibility, but for many women the pain is so extreme that calm is not possible. But if there is not a lot of energy around her, messing up her own frantic energy, then the possibility is there that there can be this kind of atmosphere where the woman can be and express all of these fears and anxieties, happiness as well, and pain, can express it without worrying about or being burdened by other people's energies. You see? That's why the birth partner, it is very important that they put themselves aside. They are not important. What is important is getting that woman to a place where she can give birth. Because that is what you are there for. The person that is the midwife or the doctor, etc., they are what you would say, they are the professionals. They have been there many times before. They have probably seen it all. So for them, you do not need to worry so much about their energy, because for them it is very much, they are separated. They have the ability to say, this is a job, this is my job. So for them it is not. You're not worrying so much about their energy. Unless, of course, they are not very nice or not sympathetic, then of course there is a concern. But most people in this position, they are not that way. So the room is important. The place that you are doing it is important. The focus on the woman and supporting her and getting her through, allowing her to express how she is feeling. And then with that allowance, you see, if the woman can release whatever is within her, of course the birth is going to be easier, because what is birth? It is a release. So if the woman can release, that is why a lot of women shout and scream, because they are releasing. Then the baby can come. Now, when the baby is coming, there is, for the woman, there is often push, and here we have the head, and push, and here we have the body. You see, there is often just these two, because it is ready and it comes. Sometimes there is more, but these are the two big ones. There we have the head, push, there we have the body. When that happens, for the woman, there is a release. Now, this release is considered to be a physical thing. The baby has released. But there is also an emotional component with that, because the mother has been holding on to this individual for, let us say, 9 months. It has nurtured it, loved it, supported it, and then all of a sudden it is gone. And the body is empty. That is what it can feel like for some women. The body is empty, because everything has been for that. You see? So there is this feeling of, yes, the baby has come out, and there is a whoosh, and then the waters, and then the placenta, and all of these things come. So there is a releasing. But what is overlooked oftentimes is the fact that what the woman is feeling is this, it actually is like a suction coming out. But what is overlooked is that that is not just a physical thing. It is also a mental and an emotional thing of letting go of that. And so whilst you now have this baby and you're holding the baby, this also needs to be honored. That you have not lost something, that you have not released something into the world, but it is like a journey for the child. It is actually the child's journey. The mother has facilitated the journey, but it is the child's journey. And when you can say the child's journey began at conception, before even. But with this motion, they have really been pushed on their way. And effectively, the mother has done that. And that is the job of the mother and the father, is to push the child out into the world. It is to prepare them for that. So this is the very first time. So there is sometimes a sense of loss for the mother. There is sometimes a sense of, have I done the right thing? All of these things that they will feel throughout their life as the child takes the first step, goes to the school, gets the first boyfriend or girlfriend, all of these things. You see all these milestones. They will feel this initial feeling. It comes from the birth. This whoosh, out is the baby. And we suggest that this is something that needs to be honored. That the mother is aware of what has happened, of the momentous occasion. It's not just that she's given birth to this, that is one part of the momentous occasion, but there's so much more to this occasion. It is the beginning of this allowance, allowing them to come out into the world and letting them go a little bit and bringing them back. It is like this kind of thing, and it is very important that the mother and if the birth partner is the other main carer, also they really feel this energy. Because if they can really feel this energy now and accept it and honor it, then when it comes, later on, every time it comes, it will not be the heart-wrenching. It will not be the feeling of loss. It will not be the feeling that, have they done enough? Are they all right? All of these things. It will be a feeling of honor, that you are here at this time for this individual, and you are helping them on their way. You are actually the one